Danae of Hatha Holistic Integrative Wellness, and you can learn more at hathaholistic.com. Today, I will have a special discussion about Hatha Yoga as well as what it's like to use CBD products with your healing journey. And we will be joined by Dr. Jessica Knox soon. And we did plan to also have Chef Megan D of Oracle Infused. Her and I are going to do an event together in Oakland in the next couple weeks. And she just let me know a few minutes ago that she can't join us. So, but we have recorded several videos together, and you can check them out on my YouTube. If you go to youtube.com, Misia Denea, that's my name, Misia, D as in David, Enea, and you'll see in the, I think it's called the integration playlist, you'll see some of the content that we've put together. And so, so Jessica just texted me, and she'll be joining me from her page, Jessica Doc Knox. So, I'll just continue to talk until she joins us. So, as you know, on Sunday, October 27th, I'll be hosting a special event with Chef Megan D. And the reason why I wanted to have this conversation today is that I think there's still some mystery, or like people are not really clear about how cannabis can be used on your health and wellness journey. And what I've enjoyed a lot over the years is that I've been teaching yoga for about 10 years, and I started out like in my body dance as a very young girl. I was in dance and gymnastics and a little bit in ice skating a little bit as a child, but dance has always been like a part of my life. Theater too, but dance has always been there. And I noticed when I was like maybe in my mid to late 20s, I had some knee issues, and I really knee pain, some low back pain, and actually I remember falling ice skating when I was 9 years old, and my low back has never been the same. But with a Hatha yoga practice, I've come to really embrace what it's like to mitigate this issue where I'm having low back pain, knee pain, and things like doing a restorative or a therapeutic yoga practice for myself and sharing that with students has been very helpful. And just going to wait a couple more seconds because I'm just texting back and forth with Jessica. So I'm just going to let her know we started. And okay. Yeah, so what I've done with a lot of some of the people that I've worked with, I have a client now that just finished having surgery it was like the end of the summer or something. But she also has some knee problems, and I did something called the knee Shavasana with her. And as you know, Shavasana is the last pose that you do at the end of the class to kind of stabilize the mind, get back to the breath. And just really simple, I put some sandbags and laid them across her knees so that her kneecaps or patella can get a little bit more space. And she did enjoy a lot with that. For people that have had, we're living in a world where people are kind of doing things more sedentary. They're definitely staring at a screen more. They're sitting, they're typing, and this has an effect on neck and shoulders. And I do in my weekly restorative yoga class at the Working Body. I do a lot of specific kind of anatomical focus with class. So I might do a week that's focused on the neck and shoulders, a week that's focused on low back and the hips, or I might even do things that are beyond the physical body and more about the emotional body, especially if you travel a lot. Some of my students travel a lot and they're jet lagged from driving or being in a plane for a long time. We're moving from summer has ended in the last few days, and we're moving into autumn and winter time, and it's more cold. And I know for me, a big part of why I moved to California is because living on the East Coast, you have Um, you have, oh, she just texted me back. I'm going to pause for just 1 second. Um, watch my live from your IG account. Okay. So, they, it, the darkness and the cold might trigger some sort of sadness. It might trigger some sort of anxiety or depression, and there's ways with a meditation practice, with a hatha yoga practice, that you can kind of curb these things that happen when it's cold outside. I also did a special Instagram live too with Dr. Kirsten Kawan, who is a Chinese physician, and she has her acupuncture practice set up in the Piedmont area of Oakland, and we've talked about what it's like to create a wellness practice during, oh, okay, there she is. I'm going to invite Jessica now to go live with me, so I just have to push button here and ask her to go live. Add her. I'll be adding her in a second. Oh, there she is. Hi, how are you?
I'm great. Thank you for your patience. I've never done this before.
Oh.
So I was like, I guess I wait for something to happen.
Yeah, you're here. Thank you. I didn't see you in class this morning. Jessica and I, she's a student, but we also take some classes together in Oakland. So I thought I was going to see you this morning, but here you are.
Yes. Sorry I missed you. I just got back from New York and I had a very, very long day yesterday. I was not up in time for 8 a.m. class this morning.
Oh, and it's just going to be you and I. We had planned it would be you, me, and Chef Megan, but she did let me know she can't make it. So sending much love to her. Okay, so can you tell me, please, what is your name, and tell me more about who you are and what you do and your website and all that beautiful stuff?
Happily. So Dr. Jessica Knox. I am a medical doctor that specializes in endocannabinology. That's a really long word, but what it means is that I specialize in the function, dysfunction, and modulation of the endocannabinoid system with cannabinoid therapies and also cannabimimetic therapies, which are things that either mimic or stimulate the endocannabinoid system towards health. And I have the pleasure of working with my family. I'm one of 4 physicians in my family who now all specialize in endocannabinology. So we take care of patients. We have clinics based in the Portland, Oregon area. So I don't get to do many of our clinics because, as Nicia knows, I live in the Bay Area. But my parents primarily see our patients in our physical clinics around Portland, and then we also have telemedicine clinics, and those are called the American Cannabinoid Clinics. Wow. And we also do a lot of educating, so educating other healthcare professionals, and that's all sort of allied health and wellness folks who are interested in the body and health. We educate all of those folks about the endocannabinoid system, but also any other stakeholder that directly or indirectly touches the cannabis industry, whether it's policymakers, lawmakers, regulators, law enforcement, patients and consumers, product manufacturers, cultivators, the list goes on and on. Anybody who is in any way involved with cannabis, we try to reach and educate about the endocannabinoid system and cannabis medicine. That's what I do. People can find us at the American Cannabinoid Clinics or on our website, drsknox.com.
Okay, great. What is you said a teleclinic?
Yeah, telemedicine. So we will see patients, by video chat, kind of like this. And so patients would, if they wanted to do a telemedicine visit because they can't get to the Portland clinics or they live really far away. I think our most distant patient is from France. They could, fill out all of their health history, send us medical records, then we can see them and evaluate them and help them come up with a plan for healing through a video.
Oh my gosh, the power of technology.
That's right.
Okay, so let me get right into it. I know we don't have a whole bunch of time. So the first question is CBD legal?
Yeah, that's such a good question. So, and it's a little bit nuanced, and I will do my best to answer it accurately, because even I sometimes am like, oh my gosh, what is going on with all of these laws and rules? So, but people might have heard about the Farm Bill that was passed at the end of 2018 that legalized hemp, and legalized CBD derived from hemp. So hemp is essentially, it's a cannabis sativa plant, the same as any other cannabis plant, except that it specifically has less than 0.3 THC content in it. So it's hemp based on how much THC is in there. So if it's a plant that has less than 0.3 THC content, then it's considered a hemp plant. And CBD that comes from that sort of plant is what has been made legal. And so that's why we're starting to see CBD pop up everywhere in everything, regardless of whether your state has legalized cannabis for medical or recreational use.
Okay, awesome, cool. I had a feeling it would be, and your response would be like that, because each state is different, right? As far as that goes. Okay. And what are some of the top benefits of CBD? I know for me, there's some people in my yoga class that have an older dog that's maybe 14 or 15 years old, and the dog has diabetes, and they've been giving the dog CBD, some of the ailments with that. And I'm just wondering, like, a lot of people are like, this is kind of new information for me, but what are and Dr. Megan, or Chef Megan, who's also based in Portland, has had some migraines, and she's used some of her CBD oil to help with that. So I'm like, what have you recognized over the years that's kind of been beneficial as far as CBD products?
Yeah, absolutely. People do use CBD for all kinds of things, and the reason it is useful for so many things is because CBD has at least 65 receptor targets in our body, so it's actually working on a bunch of different systems in different ways to help bring about its effect. And so we know that some of the primary effects of CBD are anti-inflammatory, which is hugely powerful in that so many of our conditions and ailments and chronic diseases are tied to inflammation. So it's anti-inflammatory, it's analgesic, which means it can help reduce pain, it's anti-tumorigenic, it's neuroprotective, it is antispasmodic, it is anti-seizure, the list goes on and on and on. It does a lot of things, which is why you hear so many people using CBD for different ailments. I would say the most common things we see people use CBD for are pain, anxiety or stress, sleep. People need help sleeping. And it's interesting because at low doses, CBD is actually activating. It wouldn't really help you sleep, but I think what's going on for a lot of people is the reason they can't sleep is because their mind is just racing and they're worried about so many things. CBD helps sort of quiet the mind. That gives your body a chance to sleep. But those are the primary things we see people using CBD for: anxiety and stress, sleep, and pain.
Perfect. Okay, next question. Can I use CBD with other medications? And I know that's probably a nuanced answer also, but I'm sure that's a concern that some people have.
Yeah. And it's such an important question. I'm really glad you're asking it, because honestly, most people don't ask that question. And I think that's partially because we've all heard that CBD is so safe. It's the safe cannabinoid. It's the good cannabinoid. You don't need to worry about it. It's perfect. You can just take as much as you want. And that's actually not the case. In fact, CBD is the phytocannabinoid that is the most likely to cause drug cannabinoid interactions. And that's because of the way that CBD is metabolized in our body. It's metabolized in our liver through what is called a CYP450 enzyme system. And that enzyme is also responsible for metabolizing at least 25% of prescription drugs. And so what happens is CBD can sort of slow down that enzyme from metabolizing other drugs. And so if you have CBD on board and then you're taking your prescribed medications, it's possible CBD could cause those other medications to sort of back up in your system and cause toxicity or side effects just related to having higher blood levels of those medications. Now, we haven't really seen that clinically. Like, we don't really see many patients present with that sort of CBD drug interaction. because usually people aren't using CBD in very high doses, we think that those interactions may start happening around 500 or 600 milligrams of CBD daily, which for wellness, if you're just using CBD for wellness, you're probably using nowhere near that. You might be using 10% of that dose. However, in this day and age where you really can get CBD in everything, you can get CBD in your coffee and in your smoothie and in your cookies and in your like face cream and in your, because we can get it in so many places and people think, oh, CBD is totally safe, the more the better. It's actually possible that we might start seeing people who are adding CBD to their health routine and they're using other medications might start getting some of those side effects from their other medicines that are building up in their system if CBD is preventing them from being metabolized.
Okay. So it's like everything. It has to be in moderation. You have to talk to your health professional, your physician, and so on and so forth.
Exactly right.
Good. Yeah, it is getting a little bit crazy. I mean, but that's what happens. I noticed. I mean, one year it'll be chia seeds is like the everything to your health, and then it'll be goji berries, and then it'll be tea, and then one year it was acai berries from Brazil. It's always something, but CBD, I mean, it's been around for, pot, all this stuff. It's been around for like ages,
Yeah.
Okay, just a couple more questions left. I was actually Chef Megan probably might have been able to answer this a little bit better, but I guess you might be able to too, because she has products that you use topically, like you were talking about skincare and things like that, and she has tinctures too. So do you know the benefit of CBD edibles and that type of thing, or I can skip that question if that's not something. I don't know if that's in your lane as far as like edibles and
yeah, totally. I mean, we talk to our patients and our audience about all the different ways to consume cannabis and CBD, right? So you can inhale it, you can eat it, you can use it mucosally, like as a sublingual tincture or in the nasal mucosa. You can rub it on top of your skin as a topical. You can use it as a suppository, which most people using cannabis for certainly for sort of like recreational use are probably not so interested in the suppository route, but that is also an option. So cannabis edibles or CBD edibles are beneficial for a number of reasons. One is that when you ingest CBD, meaning you eat it or drink it and it goes into your digestive tract, its effect actually lasts anywhere from 4 to 8 hours, and depending on your metabolism, it might be slower or shorter or longer, but you get long duration. And what that means is if people are trying to get, all-day pain relief or sort of, all-day anxiety reduction, using an edible is a good way to sort of get that long-acting effect compared to if you inhale it or do it as a tincture, the effect may only last 2 hours up to 4 hours at most. And so I would say that sort of long duration is the strongest benefit of using an ingested method. What's tricky about eating it or drinking it is that it takes longer to kick in. So if people have heard about like the cannabis horror stories where somebody got like a pot brownie and they were stoned off of their butts, that's because usually what happens, it takes at shortest 30 minutes, but even up to 2 hours for CBD or cannabis to kick in when you have eaten or drink it. And that's because it has to get metabolized. It has to get into your belly. It has to sort of get absorbed, and then it has to get metabolized through the liver, and then eventually it gets into your bloodstream. But depending on the health of your gut and, if you consumed it with fat and what you've already eaten, there are all of these variables that go into how quickly you'll feel the effect of CBD that you've eaten or drunk. And so that actually makes it really tricky to know if you've taken the correct dose because you don't get quick feedback. And people have horror stories because they'll like eat some cannabis and then they'll wait 15 minutes and they don't feel anything, so they eat more, and then by the time it kicks in, they're like, oh gosh, I way overdid it. That is not a concern with CBD because CBD doesn't cause that high or intoxication as that THC does, but that's why you hear those horror stories. And so again, the benefit of eating it is that you do get a long duration of effect. It will last for quite a while, but it's hard to know if you've gotten the correct dose in. But it's also another nice thing is that these days there are sort of easier edible products to use. Like you can have capsules, which are usually discrete doses, or like chocolate bars will be split into little squares that are 5 milligrams per square, and so it's easy to dose in that way.
Great. Okay. And then I have one last question, and I kind of mentioned pets before, but pets, children, or some people might be interested in how that it can help their little ones or their pets. Do you know anything?
Absolutely.
Okay.
For kiddos, and this might be controversial, but I'm whatever. So we 100% believe in daily supplemental CBD dosing for kiddos, and that's because we know that the insults upon the endocannabinoid system that can put our ECS out of balance and cause illness and disease are very common things in our world. They are
your sister's on now.
I know. Hey, sissy. Rachel Knox is here. That's my sister. Don't miss her. So some of the most important sort of insults to our endocannabinoid system and our health are just like the things that are in our everyday life. So that's environmental pollutants and toxins. It's poor nutrition. It's prescription drugs. It's stress. And then the way that aging and genes sort of play into that. So even our kids are exposed to unhealthy environments and to poor food and to stress. And so CBD supplemental can be useful for them just to help reduce inflammation in them and also sort of protect their brains and stimulate healthy brain development. Of course, we're talking about, for healthy kids, we're talking about low doses of CBD just as a daily supplement. But then, of course, we do have kids who have illnesses, whether it's seizures or autism or ADHD, who are also using perhaps higher doses of CBD to treat. I would say, of course, if you're trying to treat a child because they have some condition, please reach out to an informed healthcare provider who can help navigate what treatment should look like. But for healthy kids who you're not necessarily treating something, we're full believers in daily supplemental CBD use. My 2 nephews, who are 2 years old and 4 years old, get daily CBD, and they do very well with it. They're super active, very smart, brilliant kids. So we're in full support of that. When it comes to pets, pets absolutely, again, can benefit from CBD or cannabis. I've heard lots of stories, and even in my parents' 2 dogs, who are sadly now deceased, but when they were still with us, they got CBD, and their later years, they were more alert and happier and more active compared after they started getting CBD compared to when they weren't getting CBD. You could see that they were moving slower because their joints ached, and once they start getting CBD, they're like 2 years old again. The thing to be sort of wary of with pets is that there are some products that are starting to be developed specifically for veterinary uses for pets. And some people will ask, well, why can't I just use my own CBD product that works really well for me? And I think the primary reason is you have to be really careful with ingredients for pets. They're not humans, and there's some ingredients that are toxic to animals but are safe for humans. One great example is xylitol. Xylitol is a sweetener that is used very frequently in like sugar-free products, and so that's very common for human use, where we use xylitol instead of sugar because we want to do low sugar or no sugar products. If you give xylitol to a dog, that's poisonous. That's very toxic. So if you're getting vet-specific CBD products, you know that those should have been developed only with ingredients that are safe for pets.
Okay. Wow, we just basically had a masterclass there. Thank you so much in those 15, 20 minutes. And if you're just figuring out what's going on, I'm Nisia Patha Holistic, and we have Dr. Jessica Knox of Doctors Knox, and they are just pioneers in the cannabis and medical frontier right now. Thank you so much. She's also a beloved yoga student of mine for the last few months, and I'm so glad that I got got to meet you in that way, and our worlds kind of collide now because we both are promoting wellness from different angles. And yeah, can you, before we close, just again tell people where they can find you? Or do you have any events coming up that people should know about, and so on and so forth?
Yeah, absolutely. So people can find us on Instagram at the Knox Docs is our sort of whole group IG account for all four of us docs. I'm at Jessica Doc Knox, my sister Rachel Doc Knox, and then our parents are Janice Doc Knox and David Doc Knox. You can come to our website at doctorsknox.com. That's where we put up all of our sort of monthly events that we're speaking at, and also where we put up information for our own events that we create. And those next events that are coming up, November 9th, we're having a seminar in Portland, Oregon, which is our hometown. And then on November 16th, we're having our first Bay Area seminar in Oakland. I think it's near Jacqueline Square. So for Bay Area folks, if you want to come to our first Bay Area Doctors Knox event, that's on November 16th. And there will be information for both of those events going up on the doctorsknox.com website. And then if you're looking for our clinics, you can visit AmericanCannabinoidClinics.com. I know that's a lot of words, but that's our clinical presence.
Okay, that's so beautiful. And Jessica would come to our event on the 27th, but she's globetrotting. You're going to be in Europe or something like that, right? On the 27th? Okay.
Yeah, I'll be in Europe.
It's like,
I'm sad to miss it.
I'm in awe of everything. Yeah, no, but I'm in awe of everything you and your family are doing. Like, bravo. Okay, so thanks a lot. And I know you're getting ready to travel again, so safe travels, and I'll see you when you get back.
Awesome. Thanks so much, Misia.
Thanks for joining us, everybody. Bye.